Ready, Maestro?
Let's go.
Good morning, good morning, good morning. Thank you guys for joining. We're Talk Visual 305. We're coming to you live from downtown Homestead. We have a special guest in the room, but I'm going to let my right hand bring it in. Did you miss us, guys? So thank you again. Welcome. Mr. Julio.
Yes, sir. We do got a real special guest in the building with us today. This gentleman is a true South Dade lover. This guy loves South Dade. He is the president of TMCS Community Care. He's a registered nurse. He's got over 30 years experience in the healthcare industry. He is also the bossless, you could say the president, or you could say the boss.
The boss,
of the
not
Pi
boss.
Nu, of the Pi Nu chapter of the greatest fraternity, which is Omega Psi Phi Fraternity Incorporated. Please
say that again.
Omega Psi Phi Fraternity Incorporated. Help me give a warm welcome to our friend, my brother, Jeffrey K.
Thank you. Appreciate that.
That's it. Good morning.
Extremely enthusiastic introduction. I love it.
Well, good morning, sir. Good morning. First and foremost, we like to, when we bring our guests on, we like to say thank you for everything you have done. Thank you for everything that you continue to do, and thank you for the things that you're probably going to do in the future as you're on a great path. So we wanted to give you your digital flower. So welcome to our podcast.
Thank you very much. I appreciate it. Appreciate that.
So, Mr. Jeffrey, tell us a little about yourself. Let's give that quick introduction.
Sure.
We'll go right in it.
Sure, real quick. Listen, I was born and raised here in Miami, Florida. Grew up in my early childhood up in Lake Lucerne, North Miami-Dade, Miami Gardens area.
Okay.
I still call it Carroll City.
Right. For those who don't know.
Exactly. And then my mother became the principal of Cutler Ridge Middle at the time, and so we moved down south. Okay. I graduated from the Miami Southridge Senior High.
The Southridge.
And in fact, I was lucky enough, I graduated in 88, and then 91, my mother became the principal at Southridge.
Okay.
So I was fortunate to get out in time. My brother, unfortunately. So he was there with her as a principal.
That's it.
She was at Killian before that. And so she was the principal at Southridge for a long time. So I, went to attend Sweet Home Missionary Baptist Church all my childhood. And then went to left here to go to Howard University. Okay. Spent 5 years in D.C. Cut my teeth on in nursing at D.C. General. Unfortunately, that hospital is no longer there. But D.C. General is just like any episode of ER.
Right.
If you multiply that craziness, that's what D.C. General was. I worked in the ER and went 13 straight weeks with seeing at least one gunshot wound a day for 13 straight weeks. Yeah.
Holy moly! So
that's the type of experience that I had. So. Actually got recruited back to Miami.
Okay.
But there was in the ERs in Miami, there was only so much CHF and chest pain that I could handle. I was bored in the ER, and then started working in managed care, and just kind of went from there. So did a lot of community health. Worked for the first neighborhood resource team in Richmond Heights, where there was myself, a social worker, a police officer. We actually did home assessments. So we would assess the entire home, figure out what the issues were, and then coordinate services. So that was my first sort of delve into community health, and I've been attached to that ever since. So I've been a healthcare executive, worked for several of the health insurance companies. That's what I call being on the dark side. Right. And then now I'm more in community on the provider side. Yes.
Nice. Well, what questions do you have?
So for a person in the healthcare, if they're starting a healthcare career and they get in nursing, and they want to work their way up to management, is that a long process?
It actually is not. So listen, nursing is something I would campaign for anyone to look into, especially Black males. Yeah. Right. I want to encourage that if I can encourage anything for Black males to look at and be interested in nursing. But once you get into it, once you get that clinical foundation, I would always advise that any nurse get a strong clinical foundation. Get used to doing bedside nursing, nursing in the ER, nursing at a hospital setting, nursing at a nursing facility setting. Be comfortable in your clinical role, because then what happens is the leadership and management can branch off. So you can be leadership and management on the clinical side, or you can be leadership management on the administrative side, or you can be leadership and management on the educational side. So there are so many options with nursing as well, especially if you want to get into leadership and managing. I am proud to say that my wife and I have 6 children between us. We have 2 girls that are the same age from previous marriages. Yeah. And one of our girls is a nurse. They're 24, I think now. Wow. And she got into nursing. She went through the Baptist program.
Okay.
So she's a
Shout out
registered
to
nurse,
Baptist.
and she's already being tapped to go into nursing leadership. So it's just in a very short time.
Wow.
But that is because she's always had a strong clinical foundation,
Right.
and she's a little bossy. So we're very proud of her.
Just like a daddy.
That's it. They say the chip don't fall far from the tree, right?
So the education, you need master's degrees, do you need doctorate degrees if you want to get up there, or can you start early?
So you can start early. So and that's the other thing with nursing. There's so many levels, right? So there's an LPN, licensed practical nurse. There's an RN. There's a associate RN. There's a bachelor's RN. So yes, you do have to start. So at a minimum, your bachelor's, your BSN, and then you can move into leadership before having your master's even. But what usually happens is if you want to continue, you also want to continue with that, education. Just like there's a relationship between manhood and scholarship, as we talk, there's a relationship between leadership and learning. And so those that want to become stronger leaders usually have a tendency to want to become stronger educationally as well.
So you mentioned earlier that the very few black men that are pursuing that career. Why do you think that is?
Well, listen, so back in
That day.
1990, when I started, nursing was predominantly
Women.
female, and it was still predominantly white.
Right. Okay.
So there was always some question, and not that I'm knocking anyone's preferences. There was also always some question about homosexuality or preferences if you went into a predominantly female career. Now I can tell you, hopefully my wife doesn't see this part, being at Howard University, one of 3 males in a class of female nursing students. Yeah. I'll just leave it at that.
That came from?
There was some opportunity. Right, exactly. But also, it is a very honorable career and a profession. And so it would be great to see more young black males moving into that, and then also because of the opportunities.
Right.
Like I said, like I just talked about, the spread of opportunities with being a nurse. I would love to see more black males take advantage of that opportunity.
Understood that. So take it back. COVID, during that time frame.
Yeah.
What was that like for you?
So thank you. That's a great question. So for me, at the time, I was working at a federally qualified health center. So in the community.
Here locally?
Here locally.
Okay.
We have clinics in Cutler Bay, in Little Havana, in Broward County as well. Okay. And so we were in the community at the time, Banyan Community Health. And so COVID hit. We were one of the first to get the COVID vaccine and to do the COVID testing. It was a little scary because, people were beginning to get very sick. People were beginning to die. Right. And I took advantage of an opportunity that I had. I was a COO of the organization at the time. And what I noticed in Miami-Dade is that a lot of the communities that didn't look like us were getting the tests and the vaccines. So even though our main clinic was in Little Havana, I got on the phone. I called my fraternity brothers. I called my family. I called churches and said, hey, it might be a little of a drive for you to come from Homestead to Little Havana, but come and I'm going to make sure you get a vaccine. And so I was in a position. What I always think about COVID when I'm asked that question is I always see the positives that God had put me in a position where I could help not the community, but even my community. Right. And I did. I was able to do that, and that's what I always take out of my COVID experience. Yes, did I have people that were close to me that actually died? Yes. But I see the opportunity that I had to help the community and help my community. Door. And I was able to open the door. Yes.
When the door is typically shut.
Right.
Yeah. Or you know what I like to, with that, usually people don't think to open the door for certain populations. Right. That the door needs to be opened.
Let's give it up for that. Open the door. Vaccines, man.
Dude, I tell you, man. I mean, during the time it was very scary for us too, because being, you call it the front lines. In the telecommunication, we were open too. So we were there. We had our mask and our shields on, and we were doing curbside. So we were coming out to the cars, and can imagine being home without a phone.
Yeah. No. Or technology.
Or technology,
yeah.
right?
No.
So all of those things were super important, but the healthcare system they are superheroes, and they still are in that space. I mean, are you still doing the nursing?
So I used to
Or keep up the licenses?
Yeah, definitely keep up my license.
Yeah.
And so that requires something called continuing education units.
Yeah.
So we have to have so many CEUs a year.
Like in real estate, too.
Right.
Can
So
you
do
go on a
education.
cruise and they solve all of it on one day?
No. Now there are some cruises where you get a lot of them.
Right.
Yeah.
You go in and have it. That's it.
So I think it's 200 plus, and my level of license I think is a little more. But there are some cruises that they offer through the Florida Nurses Association that you go on a cruise and one of the days is a whole bunch of classes. It doesn't fulfill 100%.
Right.
That's
but it feels good.
But it feels good, right? Exactly.
He's like, how do you know that?
So I do maintain How do you know that? So I do maintain my license. That's extremely important to me, even on the administrative side. So I've had to say no to potential partnerships because you think ahead and say, well, that's going to put my license at risk.
Right.
And it's extremely important to me that I maintain my license.
Awesome, because then you continue to be a first responder, right?
Yes,
in
absolutely.
any capacity.
Absolutely.
Very good.
So throughout your career, you were a nurse. You somehow found your way into community care.
Yes.
And you started the organization TMCS.
Yes.
Right?
Yep.
And exactly what does that organization do?
So great question. So TMCS is a nonprofit. We do community-based. Our main mission is community-based health assessments and care coordination. So we have community health workers out in the field assessing individuals, primarily using a tool called the PROPAR, which is a social determinants of health assessment that identifies several healthcare related barriers in addition to healthcare services and needs. And then we use a tool called Unitas to help identify those services. Now, I started that because, again, I was a member of Sweet Home. I went to school, came back, was working in managed care. And as the nurse, managed care person, a lot of the people at the church will come to me and say, hey, Jeff, I need help with this. I need an authorization, or I got a claim denial. And one of the deacons said, you should turn this into a business.
Okay.
And so he helped me determine what it was, start the nonprofit. And so started the nonprofit and eventually began to get grants to hire community health workers to help individuals, to train other people to help individuals and families with accessing healthcare services.
Right.
Now, since then, we've branched out. We talked earlier. The organization partnered with another fraternity brother, John Ramirez, also known as Castro, who has an incredible fatherhood curriculum. I'd love to get him on to talk about that.
Shout out to Castro.
Yeah.
Shout out to Castro.
Yeah, definitely would like to talk more about that. So we partnered and received a grant. In fact, we've received now 2 grants to provide our fatherhood program. So that's another line of service under TMCS Community Care. And then lastly, what we're currently doing in addition to those other 2 is the expanding of early childhood autism screening. So we have screeners also out in the community that we're doing autism screening for children 16 months to 10 years old.
Okay.
And of course, just like many other things, the Black and brown communities, the prevalence of undiagnosed autism or where they're not being screened is way too high. So we are in these communities providing early autism screening. I'm proud to say that we have screened more than 500 families or individuals, kids. Right. And in that, we've actually helped confirm more than 10 autism diagnoses.
Wow.
So where the screening identifies a risk, and then we coordinate for them to get the full diagnoses.
And that screening involves what exactly?
So there are 2 screenings, one for basically age 4 and below, and then 5 to 10. One is called the Modified Checklist for Autism in Toddlers. The other one's called a Social Communications Questionnaire. Both are questions, maybe 9, 10, 12, I think, questions that are asked of the parents. Does your child look you in the eye when they're talking to you?
Right.
If you walk into a room and start talking to them without calling their name, do they respond? Are they acceptable to children that walk up to them? Those kind of questions. And then based on the answers to those questions, all yes or no questions, the tool gives you a score that would indicate the risk of that child being autistic.
And when does that diagnosis actually occur?
So the next step is that if it indicates a risk, we coordinate to either primary care or neurologist or psychologist who has a larger evaluation, including observing the child,
Right.
that will then confirm, yes, the child meets all the characteristics of being autistic, and then let's start the
Right.
therapy. Because early treatment is the key.
Right. Patches. You do the.
So we work with patches. We've had some events with patches. Now, patches is a great service for once the condition has been diagnosed.
Right.
And then they also do things other than autism, but definitely patches is a community partner that we refer to for services, and then we work with to help them spread the word about early autism screening.
Do you go beyond Homestead? Where's your?
So right now, this
radius?
grant is all of Miami-Dade.
All of Miami-Dade.
Yep. So we're screening all over Miami-Dade. Yeah.
Very good.
Okay, so I'm seeing two different parts. One is just community health care.
Yes.
For less fortunate individuals that may not have the means to have insurance, right? Can they just show up to your facility?
They can give us a call. We can do telephonic, virtual, or they can come to any of the facilities, and we do screenings. And I just want to make one correction, because what we're seeing is that it's not just individuals that are less fortunate that don't have insurance. Sometimes it's individuals like you and I that just don't understand what is going on with their insurance, and still insurance that they have or they're paying for don't cover certain things, and or especially lately, they also have these social determinants of health. You have individuals that are maybe in our station that have to think, well, do I fill the car up to go to the doctor's appointment, or do I have them mail me the medication? There are things that they sometimes they just need hand holding through those decisions.
Right. So the telepath, being able to call in and telehealth. Sorry, you have that available.
Yes, absolutely. So we use all that technology.
Wait, I'm still confused a little bit between
It's okay.
between healthcare and autism screening.
Yes.
Those are services that you provide all
under one
the
umbrella.
same umbrella.
Yes.
Right.
So the way I see it, if you ask me, I can relate anything in this room to healthcare as a nurse, right? So I did not want the organization to be pigeonholed into just one thing. So if you look at the umbrella of TMCS Community Care, there is the community health component, there is the fatherhood component, to which, by the way, we add care coordination. Okay. So mental health, self-awareness, assistance with community services for the fathers and the child. Okay. And then there's also the autism screening.
Wow. Do you foresee it having a mobile version of that?
So because of our model, our offices, so we have 3 locations.
Okay.
We have a location in Richmond Heights. We have the location right here in Homestead, right? Okay. And then we have a mobile unit that we. So our model, however, is to be out in the community.
Okay.
We would prefer for someone like Patches to say, hey, we're doing a family event. Can you come and set up your mobile unit at the family event? We'll be there all day, providing all the services.
Right.
So if we're always looking for community partners.
Okay.
To invite us out to their events, invite us out to their facility, because again, you have to meet certain people where they are.
Do you see that? Do you see Baptist or one of those bigger outfits like what is Leon? And is there a partnership in that space, or they're more competitive, more so?
No, so I'm definitely not a competitor to either one of those.
Right.
In fact, we would like to be a partner because, again, as we're in the community identifying individuals and families that need services, we would like to have a more streamlined way to refer to those. So today we do make referrals to Baptist. We have actually referred individuals to Leon Medical Center down here. Okay. But it's all informal. Right. So, for example, with CHI, we actually had a formal meeting with them, and we actually have, I won't call it a backdoor, we have a more direct way to refer individuals, especially kids after the autism screening that need primary care. We have a direct way to refer to their primary care center.
Right. I think what Brother King does is they provide a different service, that alleviates these other entities that you spoke about, like Baptist and Leon. So they have like a niche, and then they say, okay, once that person or that individual comes in, they'll know where to direct that person, or they'll provide services that's in their wheelhouse.
Right.
Yes.
Okay.
Interesting stuff. And I know that you mentioned you've got 6 kids.
Yes.
Your youngest daughter was diagnosed with autism.
Yes.
Right? And I saw and I read that she's got a rare chromosome that is
DDX3X.
DDX3X.
Yes, it's tongue twisting.
Yeah. DDX.
Do you know about DDX3X?
No.
I'm not familiar with it.
No. That sounds like a vitamin.
But I wanted to ask.
It's not a vitamin.
It's within the spectrum.
So DDX3X is a rare gene mutation. It impacts the X in the XY chromosome. It impacts both males and females. It's just that since the males only have the one X, unfortunately, they don't live as long as the females.
Understood.
The females, so today there's still only 1,180 confirmed diagnoses of this condition worldwide. 1,140 female, 40 males.
Worldwide.
It's still extremely rare condition.
Wow.
The physician that discovered it back in, I think it was 2014, decided, hey, don't name it after me, name it after the condition so that it can be more readily found. So the girls that have the condition, they are also on a spectrum, just like autism spectrum disorder. So some girls can't walk, can't talk, don't have any movement abilities, are fully disabled. Some girls can do all three, but then have other intellectual disabilities, and then there's a range. So our daughter Jasmine, she can walk just fine. She has some fine motor disabilities, but she's nonverbal. She can make sounds, but does not speak any words. She can do some sign language, but she can't do any, again, fine motor. So J for juice, she can't quite do, so she does a big circle for juice. She has difficulty, for example, holding a pen and writing. So you can say, hey, Jasmine, write me a J for J, and it looks more like a check mark because she simply can't hold the pencil. So we've been dealing with that, and we were talking earlier that part of the problem is that the genetic tests that help us identify the diagnosis was a $20,000 test.
Wow.
And one of the first, once we confirmed the diagnosis, we went to, there's the DDX Foundation, DDX3X Foundation, that does a family gathering every year. We went to that event, and I was talking to one of the scientists, and we're looking at all the kids, and she says to me, you know, I'm concerned that we might be missing a population because of the cost of the testing. And I said to her, leaned in and said, do you mean, are you concerned because my daughter's the darkest child in this room? And she said, yes, I just didn't know how to say that. So that's okay, you could have said it. So for sure, I think in the black and brown communities, there may be more diagnoses, just like we know there was more autism. It's just that we weren't getting screened. So I'd like to see us have more access to those types of services. Fortunately, and one of the things that brings me to Homestead every day is that we were able to find a school that is outstanding for children with special needs. So Jasmine attends Neva King Cooper Educational Center, literally a catty-corner from here, right across from on Chrome. Great facility. The faculty and staff are amazing.
Shout out to them. Right?
Yeah, shout out.
Let's
to
give
them.
it up for Neva.
Yeah, for sure. Love them there. And so that's where she attends school, and so that has led me to be more involved in the Homestead community, and so I'm always down here, and either at our Homestead location, or working with the school, with the individuals at school with Jasmine. And so our daughter is doing great. She's 11 years old now, and she's progressing, doing a lot better with different things. But as we were talking about earlier, Julio, it does take that discipline, and so and it's work. The parents, shout out to parents of special needs children, because it's work. When you realize, oh, I can't just hop up and go to the bathroom. You have to plan through that if you're home alone with the child. Especially as Jasmine's gotten older and more curious and because they don't know fear, they don't understand what to be afraid of.
Be on alert.
So you have to be on alert 24/7. So
now, when you were thinking about where she ought to go to school, are there many schools that specialize in autism?
So there are many schools. Not many of them are public. So public schools, they're just a handful. Many of the public schools, they're normal, your standard school, might have a class or programs for special needs children. So they may have 2 or 3 classrooms and some specialized faculty and staff that provide special needs services for a set of students amongst the hundreds or thousands of other kids. Schools that are only special needs, there's only a handful that are public. Now, there are many private and charter schools that provide those services, but once again, not all of us can afford that. Right. There are some programs to help with some of that cost. Again, not all of us are aware of that. So it's a lot of my role is about awareness and getting individuals to understand what the options are, not necessarily forcing one option or another, but at least being aware of what is out there.
Now, if there's parents who are just now understanding that their kids are special need and they want to put their child in a specific school, how do they gauge the education that the child is receiving as they're going through that curriculum or whatever it is that they're doing at the school? How do you know if it's a good school, if it's a bad school? Because I've heard only great things about Neva King Cooper. How do you compare that to another school?
So first of all, you keep the focus on your child. The term special needs, sometimes it's not seen as super positive, but that special needs isn't really about the group of individual or kids. It's about that individual child. So if you start there, knowing and understanding what my child needs to grow and develop. Now, and then you have to have expectations. Once you understand that, then you have realistic expectations, and you know that, okay, no school is gonna teach my special needs child calculus, in a year. So you have the right expectations, but in something that the school requires called an IEP, individualized education plan. In your own plan of what I want, things I'd like to see my child accomplish. And so for us, it was simple. We'd like to figure out how to keep Jasmine engaged, just to sit in a chair for more than an hour, because she doesn't sit at home. She's running back and forth, and she's wandering, she's moving, even if she's preoccupied with her tablet. So we got to that milestone. Okay, perfect, check. Now, how do we get to a point where we understand and recognize that she recognizes letters and words?
Got it.
So Neva King was able to get her to that. So we know for a fact I can point at this paper and say, hey, point at the E, and she can point out all the E's, which of course for us was like, it was like absolutely amazing.
That's it.
So you kind of have to gauge based on your child's needs and realistic expectations of what the school can do, and then it's just a constant, continuous evaluation of towards that goal.
So where do you see it evolving to, in your opinion, of the healthcare system for?
Well, I don't.
Yeah, unpackage that.
That was a well packaged question. So listen, I am one. I learned from a mentor of mine, Dr. Bill Kirsch, who's a physician, and I believe that there's really only a handful of things that have to be done in the hospital. TMCS Community Care, our motto is the best care is in the community. I believe that what is going to have to happen is that healthcare is going to evolve sort of back to, and I always think of Little House on the Prairie, where the doctor used to come to the house. It's gonna have to evolve to that. Now we have technology today that we can do virtual visits, we can do telehealth, but I think staff like nurses, support staff, community health workers, therapists are going to have to be more out in the field, in the homes, in the community, and more preventative. I think that we use telehealth and response services when there's an issue today in the community. We have to push it up to be more preventative, meaning I'm out in the community, I'm evaluating with individuals. If I have an individual who's diabetic, hypertensive, overweight, it's one thing for that person to be in my office and I say, hey, you have to change your diet, you have to take your blood pressure and your blood sugar, and then you have to watch what you're eating, versus if I go to their home and I evaluate the environment, and then I can say, okay, now I see why what I say in the office just goes in one ear and out the other. So I think the evolution will be more community-based, hopefully more preventive, so upfront services and care. Definitely more technology, whether that's AI or not. I would love to see AI step in more. And
You're not fighting it?
I'm not fighting it. And again, I may not make it to my car with some of my nursing companions, but I think a lot of, and even in the hospital setting, a lot of things that nurses do could be replaced by technology and could be automation, right? And then use our clinical skill to really help
diagnose and understand the environment.
Exactly, right.
So I think doctors today there's two routine. You go in there, they say, let's take a blood test, and then they get the blood test and they go, okay, just take this medicine. Thank you, goodbye.
Right. Next.
And that's it. They don't really dive into what's going on with you.
Well, they can't. So I may get caught before I get to my car in defending this, but in order to survive today, a physician unfortunately cannot spend too much extra time going through all the details. And so that's what I'm saying. If there's some automation somewhere else, the physician can come in, even if he or she is looking at this and says, okay, 1 + 1 = 2 here, take this pill, and then let a nurse or a case manager or a community health worker work through, okay, now, Mr. Guzman, what are the barriers to you taking this pill? Okay, well, there's a $50 copayment. I have to figure out how to eat. You told me to take it with breakfast, but I can't really afford breakfast. I only eat once a day. There's usually a whole list. So let a nurse or a community health worker or case manager help walk that person through removing those barriers, and then we have better outcomes.
That's true healthcare.
That is true healthcare.
That's old school.
That's old school, right?
The goal is to get back in the community, right? We've kind of shied away, and even from not being on the healthcare side of community. All the conversations are leading back to that child is acting this way because it takes a village.
Right.
Well, there is no current village right now.
Right. There's no
village.
village.
No village at all. You go around town and you says, listen, this kid is acting out, and you go, there's no one there. I know that some of our team, we go door to door and we knock, and sometimes the child is answering the door. And just yesterday we saw it where a kid is in his diapers answering the door. I'm like, whoa. Sorry, knock, mom, hello, make sure everybody knows. Then we said, please close the door, get out of here, because they shouldn't have. And we kind of, as we were in the community, 50 different homes, at least 10 of them, a toddler.
Right.
Toddler answered the door.
That's crazy.
How's that even possible, right?
And sometimes when you do go to a doctor and you seem to get that service that is not normal, you start to say, hey, wait a minute, is there something wrong here? Is my insurance going to be able to afford the service that I'm getting? So you feel out of place when you get service that you deserve to get, regardless. So I understand what you guys are saying.
That physician most likely is running a shop where he or she, I don't want to say doesn't care about, but is not putting profits first. Sometimes it's necessary. I mean, sometimes a physician, if you're in a clinic and that physician is probably feels like you're rushing through, they probably have to see 30, 35 patients a day just to keep the clinic above water. Which is sad, and leads to a different conversation. But that's why you sometimes feel that. But I think the evolution is we move away from that. We provide other supports so that physician can do his or her role in making the clinical decision. Now someone else helped to actually implement that clinical decision.
Most of the doctor's office, they have nurses in them, right? And after the doctor come in, he would skip or they're dictating, and then they go, okay, boom. You good? You feel they do a couple of check you out quickly, and then on to the next. Most of the time, you're spending 30 minutes just sitting there, waiting for your wrong. But we would like to see, like you said, slow it down, understand why you're there, have a conversation. It's almost like the conversation is being pulled out of it. They look at the chart, and this chart is all they need to hear. They don't want you to say nothing.
The problem there is that nobody pays for that second part.
The conversation.
Nobody pays for the conversation. Nobody pays for the nurse to do the follow up. Nobody pays pays for a community health worker to go to the home to help work through the barriers. Nobody pays for it. So that's why through the nonprofit we have grants to assist with things like that. But the physician clinic office can't necessarily do it because it's not a revenue model for them.
Wow.
So through all of that, your career, it seems like you're living a very busy life and you're giving so much back to the community. How do you manage to find the time to be the boss list of the Pi Nu chapter?
Well, thank goodness my wife is not here to answer that question.
Yeah. But she's watching.
She's watching. Julio, it's not easy. Now, I can tell you the only way that I've been able to do this is through the support of my executive body, my executive board. And, I have individuals that I can tap to assist. And then within the chapter, individuals that are, as you know, we have several committees for each project, the committee chairman that I can tap and say, hey, we need to do X, Y, and Z. So it requires a great deal of support from other individuals in the chapter. It is extremely important to me that I give back through the organization. The organization, is I don't just love Omega Psi Phi. I am in love with Omega Psi Phi. I am dedicated to Omega Psi Phi and to the things and the services that we provide. Being the bosses does take a great deal of time. However, once you get through a certain milestone, you look back. When we do our turkey drive, our Thanksgiving drive, and you're looking at the individuals, the families that you're giving food to, that right there, that moment right there, washes off.
It warms your heart.
When we do our Christmas toy drive and those kids are overly excited about being able to walk through that aisle and pick out a toy, it just warms your heart. When one of the other great things, when we do our roadside cleanup,
which we just did a few weeks
ago,
ago.
Exactly. When we do our roadside cleanup, and you experience, and people honk and wave, and you're out there, and you're thinking, you know what hits me a lot, let's see, and I look around, okay, 1, 3, 6, and then there are 5, 6 individuals that represent 9, 10, 12 degrees.
Right.
You add up the salaries. But where are we this morning? We're out here picking up trash.
And there's a lot of trash on the side of the road
Yes.
which you will not sometimes always see because
right.
you're driving past it. But when you're out there walking the street, and it's from 280th Street to about 268th Street, Shivers to Moody, right?
To Burger King,
just a short section.
On both sides of the road.
Yeah. Wow. So 2 miles.
There's a lot of trash. And we're out there picking up
So
trash.
when you take all that in, and it humbles you, say it doesn't matter. Right. Doesn't matter the degrees, doesn't matter the salaries. This needs to be done, and we are here doing it. That is what makes it all worth it.
Well, of course. Service above self, I say.
Absolutely.
Okay.
No, and they're active too.
Right.
The Pi Nu chapter, you keep them all engaged. They're very active, and it's the chapter that's deep South Dade. It's down here in South Dade.
Yeah.
Very good.
So I look forward to continuing to work with the Pi Nu chapter.
Absolutely.
Zeta and Pi Nu chapter is doing great things in this community.
And one of the things that's important for me to say, especially that I have this venue, is that individuals in the community, they see the purple and gold, they see Omega Psi Phi Fraternity Incorporated. They might know that Julio Guzman is a member. They might know that Jeff King is a member, but they don't see us as individuals.
Right.
They don't see us as individuals. They don't see the individual chapters.
Right.
They don't know Pi Nu from Sigma Alpha from Zeta Nu Nu.
Right.
Nor do they care. Right. You're like, what are you talking about? They see the fraternity, and that's what is most important. And I think it's an amazing thing for us to dwell together in unity, and make service happen.
So I have a question on a lighter note. What is fun for you? Real fun for you?
So real fun for me is, one, I'm going to say this, get some points. Any moment where I'm laughing with my wife,
right?
That's fun for me.
Give it up for the wife.
Yeah.
Makes it all possible.
Yeah, it makes it all possible. Could not do it without her, could not do it without her support, could not do it without her, I'm going to just call it permission, because she allows me to do this. But any moment that we're able to sit and laugh and find something humorous in a situation, that's fun for me. We try to go out, but again, having a special needs daughter, we have someone who sits with her, who is also amazing. Who is she's in school to be a diagnostic technician. And she's wonderful. So anytime we get a chance to go out, and sometimes that going out is we're just going somewhere to have a few drinks and hang out, or going to a movie.
Right.
So that's fun for me. Any time with her, and then anytime that I can sit out back. I have a deck that I built out back. Just kind of relax.
You create your own,
create my own
your
little
own environment where
right.
people can all come to you.
Yeah, exactly. Right,
and let's
right.
just hang out
Right.
and talk some
and
trash.
So I'll call a few fraternity brothers over and come over, let them get some education, because I am the most knowledgeable.
Right. Yeah. Just saying that.
Just so you know.
Just putting it out there, you know?
Yeah.
That's it. The source.
So that's a great question, man. But that's fun for me.
My wife was hoping to meet your wife at the 50 Shades of Black event, but we didn't catch you.
Yeah, no, we didn't make it. So when it got moved again, the babysitting. So we had figured out the schedule with the first location. But then the move added another 40 minutes to the drive, and it was like, the schedule. We just spent more time driving than at the event. Yeah, so we invited a few other brothers to
That's
to
it.
take
And
over
even he told me about that. I'm like,
yeah.
it sounds like 50 Shades of Grey. I'm not sure I want to be one here in that environment, you know? It's costly.
So, Jeff, for anybody watching, for the audience, any young people that are trying to pursue the same career, what advice and what crumbs would you leave them today?
So, first of all, once you make the commitment, you want to go into healthcare, nursing, or anything healthcare, don't let lack of funds be the deterrent. There are very good schools out there that will provide funding. There are programs that will provide funding. So don't hesitate to move forward because you think you might not have the funds.
Okay.
Right.
Find a location, find a school, do some evaluation, and then once you make that commitment, move forward, understanding that nursing, especially nursing, has so many options.
Right.
Yes, people say nursing, oh no, I can't stand the sight of blood, or I didn't want to be cleaning bedpans.
Right.
That's just one small portion of it.
Okay.
Right.
If you can get through a couple years of doing that, the options and opportunities in nursing are so broad that it's well worth, seeing blood or cleaning a few bedpans.
Right.
And plus that again adds some of the humility. When you get to a point where you are overseeing a staff, in an administrative setting of nurses and other individuals, you look back on the time where you had to do some of the dirty work per se, and it makes it more worth it.
It's one of the more secure jobs
100%.
that are out there. And to give you an example, I'm in real estate. If I'm renting a house for someone and you've got, let's say, an electrician, which is now everybody's talking about being an electrician and an AC tech, those are some pretty well sought after jobs right now because there's so few. Right. But if you've got to, decide between a nurse and an electrician on who you think is a better fit for that home, 9 times out of 10, the nurse is going to be the one selected for that home. So anytime you say, oh, it's a nurse and they've got some time at the facility they've been, it's a pretty stable job.
Yeah.
Right.
And most, the other thing too is that, whether it's a sign of the times or not, but most nurses I know, they don't just work at one place.
Yeah,
they can work 2 or 3 places. When I first came out of back to Miami, I was working at 2 different hospitals. Sometimes I would work 12 hours ER in one hospital and then 12 hours on the floor at a next hospital with maybe a couple hours sleep in between. Right. Because I could, and there was a need. Nurses can work in the hospital setting. They can work in home health. They can work in administrative. They can work remotely, case management.
The traveling.
Traveling nurses, talk about the cruises. Nurses on the cruise.
That's it.
There's so many opportunities with nursing. It's unlimited.
One of my best friends, Omar Pereira, graduated from Columbus High School. He moved to New York City and is a nurse. And his career evolved into being a traveling nurse in a way, but in that city. So like you said, they work for multiple places. And New York City's been one of the toughest places to live. But him and his wife, his partner, are both nurses and they're doing extremely well. They've got 2 kids now. And they got a 3rd one on the way. So
awesome.
Shout out to them. Very good. So any final words that you'd like to leave with us for our audience? I mean, as we tend to leave crumbs for the next generation coming up, because a lot of times, a lot of the success stories are ones that's not told. We can't hear about them. We kind of stumble on it. But we're trying to create a path where one can listen to this podcast or listen to podcasts out there and say, you know what, they left some good tips and tricks along the way. Is there anything that you feel that you would
I'll piggyback on what you said. To the next generation, you are going to stumble at some point. You're going to fall down at some point. Nothing is going to go perfectly.
Right.
You're going to run into barriers.
Right.
Probably multiple.
Right.
The key is how you persevere and push through them.
Right.
You have to have perseverance. You have to have the desire to push through. You have to understand that there are going to be barriers. Not allow them to get in front of you. So don't let fear stop you, but let fear push you.
So find a community too?
Find a community. You have to, that's the other thing. Accept the help.
Right.
Accept the help.
I don't need it.
I don't need that. Right. You're gonna run into where you run into a barrier, and then sometimes what I've noticed is that the generation, you have multiple people reaching out to help. Oh, I don't need your help.
Right.
Accept the help. If I had not accepted the help in so many different situations, I wouldn't be here today.
Right. I think none of us would. Right. I mean, at some point, someone said something, and you can run on the hill and see for yourself, or you can say there's a pothole, and they said, "Hey, I went down there before." You're going down the wrong path, my friend.
Exactly.
You should simply, take a detour.
Right. Right. Or be careful when you go down that path.
Just know that if you're going to run, don't run, walk. Right.
Exactly, right. Or count your steps. It's about that 10th step that you might want to look for the potholes. So slow down.
You're not
right.
listening.
Exactly,
Right.
right.
You're not listening, right? But understand, we truly appreciate you coming on.
Well, thank you for having me.
So, if anyone trying to reach out to you, is there any number or email address that you would like to give to audience?
Absolutely. So you can reach me at jtkingrn@tmcscommunitycare.org. My number 305-305-2532, and of course we are on our website www.tmcscommunitycare.org, and reach out if you have questions, especially about any services that you might need for you or your family, and or if you're interested in getting your child autism screening, definitely reach out and give us a call.
Thank you, Brother King. There's a lot of talent in Omega Psi Phi Fraternity Incorporated. He's just another example. We appreciate what you're doing. We look forward to having you on again.
That's right.
And
absolutely.
Open
keep promoting
invitation,
everything that you're doing. Thank you, my brother.
We truly appreciate you. Thank you,
Appreciate
guys.
it. Thank
Until
you.
next time, we'll see you guys.